أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم نحمده ونصلي على رسوله الكريم سبحان ربك رب العزة عما يصفون والسلام على المرسلين والحمد لله رب العالمين إن الله وملائكته يصلون على النبي يا أيها الذين آمنوا صلوا عليه وسلموا تسليما صدق الله العلي العظيم. Dear all, Assalamu alaikum. Hope all of you are fine and doing well in this hot weather, preparing nicely, listening to your teachers. I would like to say something about your output after clearing this second year, and there is always hope to have the best result, and you will give us inshallah just like the previous class. They had given 100% result in BDS annual and 100% students they cleared the pharmacology in third year MBBS. All of those latecomers, they did it well in time. Inshallah, those who are latecomers, who joined us after 4 months, rather more than 8, so they will compensate it, and I'll have consultation with your other teachers how to give them extra time and at what level. Anyhow, coming to this very topic of drugs acting on GIT or the GIT illnesses, well-known disease is acid peptic disease. Acid peptic disease. Previously, this was given name as peptic ulcer, say years back. Also, 50 years back, it was also known as psycho ulcer, psycho. So, in the past, there were no medicines to treat this acid peptic disease. Only what I remember from the historic point of view, my mother had this acid peptic disease, and they used with severe pain, abdominal pain, and used to relieve with vomiting, or she was given this kava of black cardamom. Still, that is very effective in certain GIT disturbances. Anyhow, then your teacher delivering lecture also got it from my mother. You say it may be genetic, so I am hyper secretor of this acid, hydrochloric acid. You know, people, they are divided into two types: hyper secretor of hydrochloric acid and hyposecretor. Your teacher is hyper secretor since childhood, and I always keep some antacids for symptomatic relief in my pocket in general. So it's division. People are hypersecretor, people are hyposecretor. So what's the etiology of this acid peptic disease? Still unclear. Drugs from various groups, they are tried to treat it. So In our body, pathology would etiology, the causes of how ulcer is formed and what is ulcer. You should go through the dictionary what is ulcer, and as the name indicates over here, acid peptic disease. So it means the acid is damaging mucosa, and pepsin is damaging mucosa. In the stomach, when the pH is below 2, so the ulcer site or the spasm will occur over there, and there will be pain. If this pH is raised above 2, pain is relieved, and if it goes above 4, even the pepsin production that is released. Both these substances, acid, it is produced from parietal cells, and what is the daily total output of this acid? Previously I had read it's around 2 liters a day, but now in the recent literature it's a 2.5 liters a day. There is good production of hydrochloric acid in your stomach. So most of the medicines, they are working on this acid, how to suppress it. In our gut, in our stomach, natural mechanisms are there. Acid is being produced. If it is more, it's damaging. Pepsin is damaging. Bile salts, they are also damaging effect. But on other side, the natural system is also there to protect the mucosa. Those are the production of prostaglandins, production of mucus, production of bicarbonate, release of nitric oxide, and also to increase the local blood flow. So these are the things which have got protective effect on the mucosa. They are going side by side. You will be shown later on in a slide how they are working. On one side, the mucosa is being damaged, and other side is being repaired. So they are going side by side. So number of drug groups, they are used to treat if the ulcer is formed or if this acid peptic disease. When we say the peptic ulcer or the acid peptic disease, so a number of certain other disorders, they come under it, like what is peptic ulcer? An ulcer which is at the lower end of the esophagus. They may be in the body of the stomach, maybe in the duodenal ulcer may be there. Bile reflux is producing ulcer, and then well-known example is the GERD, G-E-R-D, GERD, gastroesophageal reflux. It also comes under this acid peptic disease. And this peptic ulcer may also be there where gastrojejunostomy is done. Gastrojejunostomy is done. A number of different drug groups, they are used to treat this acid peptic disease. So out of them, how to treat it, certain medicines are there to just to relieve the pain, and one well-known example is these are the gastric antacid. We will take in this lecture to some extent. And then there are substances which protect the mucosa mucosal protectives. They are known as mucosal. Then certain secretagogues of HCl. Secretagogues of HCl, they are used to treat this acid peptic like the H2 receptors blockers. H2 receptors blockers. Well known example, all you know, you might have seen earlier, cimetidine. Given to people say for 2 or 3 decades in Pakistan, and then they relieved. They expressed that it has got certain adverse effects, so alternate drugs which suppress the H2 receptors, they were used. Say that ranitidine, another example, considered as safe. Then substances among the secretagogue, gastrin is another one, gastrin, that also stimulate acid production. Then another group is the muscarinic receptor blocker, especially the M1, previously known as M1 blocker. Pyrazipine was a known example, and then M1 blockers. So different. Well-known drugs nowadays which are over-the-counter available. Mostly these drugs are available over-the-counter, so abbreviated as OTC. These are the proton pump inhibitors. Proton pump PPIs. So the final path of hydrochloric acid production. That's one. So as consider these medicines, we will take over here about the antacids and their role in the treatment or the alleviation of the pain in peptic ulcer. Antacids, also knows, they are known as gastric antacids. Gastric antacids. They are given, gastric antacids, for the partial neutralization of acid. As you know, the hydrochloric acid, it has got physiological role and is required in the body. So be careful. Complete suppression of acid production, that's not good. Number of other disorders will appear. Condition where in certain condition is one disease, this HCl is not produced, and that's known as achlorhydria. So the HCl is the partial neutralization which is required. So mostly the substances which are used to neutralize, partial neutralization of the hydrochloric acid, these are cations, divalent cations combined with anions like bicarbonate, carbonate, phosphate, chloride, etc. These salts are given and they have simple reaction with the HCl in the stomach. So there. Let's come to the next, know about the slides, and they will be discussed. Learning objects. Why we are studying this acid peptic disease. At the end of the lecture, you should be able to classify various drugs which are used to treat this acid peptic disease. Secondly, how those drugs act, you should be able to write down. Then the merits and demerits, advantages and disadvantages. Now the word as concerns the disadvantages, nowadays it is taken as toxicity. The number of different salts, metals, divalent cations, metal salts, they are used to neutralize this HCl, and they have their merits and demerits. Then after that, H2 receptors that will be taken in the next lecture. Just note down and always have a copy with you and a pen. So certain things which are not mentioned over here in slides, you please note them down. They may be asked in your viva, may be important otherwise. Here, the different conditions which come under this acid peptic disease. So this one given over here is the GERD, gastroesophageal reflux disease, GERD. Second one, you have been told about the peptic ulcer at various sites in the GIT, and then these ulcers, they are years back they were known as psych ulcer. Even now, if the stress is there, strain is there, maybe psychological, maybe surgical, so it may result in mucosal injury. So ulcer as well. You know, ulcer is breach of continuity of mucous membrane or any other lining in the body. Next, you have already been told about how the system is running in your body. Certain substances produced in body, they are damaging the mucosa, and the others, they are repairing it, so they are going side by side. Here you see on your right side acid that has damaging effect on the mucosa. Pepsin also, that gastrin, it produces HCl production is there. Then bile reflux, it has got damaging. Then free radicals, then leukotrienes. These are the offensive factors or the damaging effects, and the repairing factor going side by side. The natural system to protect it from these offensive factors, Allah has made them. There is more production of mucus, more production of bicarbonate, blood flow to the area is increased, prostaglandins, especially prostaglandins, they are misoprostol, prostaglandin E2, given with antacids to protect from illness. Then certain substance, strength of mucosal cells. There certain, these prostaglandins, they have mucosal protective effect. Next, we come to next slide. Here, etiology. Previously, it was unknown that H. pylori, it was introduced say 20 years back, that it has got this effect of damaging and producing ulcer. So because of this bacteria H. pylori, so number of antibiotics they were added. H. pylori infection, here it is written that in 90% of the cases where this acid peptic, the peptic ulcer is there, it is due to the use of antacids or the presence of H. pylori. You are all familiar. Then severe stress, it produces. Then smoking is also related to the damaging effect on the mucosa. Then on right side, unhealthy eating habits, hot food. Then excessive intake of the hot food or strong alcohol. Then family history. You have been told that my mother, she suffered from peptic ulcer. Later on that perforated. But Allah saved her and she survived good time after the perforation. Coming to the complications. Here you see on the left side, if it's advanced stage, so there may be blood in the vomitus. It is known as hematemesis. Then on right side you say the perforation has occurred. Ulcer in advanced condition may form a special shape known as ulcer crater. Then below, here is stricture, constriction of the at the gastric outlet obstruction, pyloric and pylorus. There is strictures, narrowing of the. Then physiology of acid secretion. How the acid secretes. You have been told. Number of secreted cogs are there. Here acetylcholine. It has got this acid production effect. Then gastrin, they cause increase in cytosolic calcium, and at the end the hydrogen potassium ATPase, that is the proton pump, that is protopump canalicular surface, that produces hydrochloric acid. Then it is in the line given below, the total production, if there is secretion, is 2.5 liter a day. It's a big amount. Here is one picture. How the HCl being produced and what are the secreted cogs and how the natural system is there. On right side, you the secreted cogs. These are the gastrin, histamine, acetylcholine, HCl, and the proton pump. So HCl produced. When more HCl produced, pH that will come down. And on other side, on your left side, here you say the somatostatin is produced more, so it has got an inhibitory effect on the gastrin that goes into the blood. So although a lengthy picture, but take it simple. Then we come to the major effects of gastrin. How the gastrin is acting over it. Gastrin upon acid secretion mediated indirectly. There's indirect way through the release of histamine from enterochromaffin-like cells rather than through direct blood cells. So gastrin is acting indirectly, while the acetylcholine, it has got potent direct parietal cell stimulation effect. These are the secreted causes. The various drug groups which are used to treat this acid peptic disease are the hyperacidity. They are given over here. We will talk about antacids. So just see this division. H2 blockers are given. PPIs are very much popular. Mucosal protective substances are there. Then antibiotics, they were added to treat this H. pylori, given for 2 to 3 months. 2 to 3 weeks at least. So when three substances are given together to treat it, that is known as triple therapy. If four are given to treat that infection, it is known as quadruple. Note down triple and quadruple. It is asked in your exam. Drugs used in treatment of acid peptic disorders may be divided into two classes: those which reduce the gastric acidity and those which promote the mucosal defense. You have already been told about it. Coming to the acidity again, antacids. Here you see they neutralize gastric acid. pH is raised, and you have been told if the pH is above 2, the pain is relieved. So well-known examples are different salts, sodium bicarbonate. They are divided into two types. Those which have got systemic effects like the sodium bicarbonate, potassium bicarbonate, sodium hydroxide. Over here, sodium bicarbonate is a well-known example, must be studied in detail. Then calcium carbonate, aluminum hydroxide, magnesium hydroxide, they are known as non-systemic. I mean, the main effect is there in the gut, in the stomach. Not well absorbed, but in case of denuded surface, to some extent they may be absorbed, and at the same time, if the kidney they are not working properly, their level may increase, like that of calcium, sodium, aluminum, and magnesium, etc. It's something very simple reaction between these antacids. These are weak bases, and with the HCl, so the salt is formed and the water is by intragastric acidity that will go down. General uses in indigestion in case of heartburn, for the symptomatic relief of peptic ulcer and GERD. For acute pain, they are very effective. Sodium bicarbonate is very effective, and GERD. Few lines about the sodium bicarbonate. Here you see the simple reaction. You are all familiar with it. It is cheaper. Sodium bicarbonate in the baking soda, cheaper. Onset is rapid, and it may increase the pH even up to 7. So for alkalinization of the urine may be given, or to treat acidosis it may be given. In those it will be effective. Disadvantages about the sodium bicarbonate: duration is shorter. One thing very important about whenever you are prescribing in these antacids, you should consider the cost of the antacid. Economics, pharmacoeconomics, palatability, then solubility of an antacid, onset of action, duration of action of antacid, then their side effects, drug interaction, you must consider. You should also consider the acid neutralizing capacity of an antacid. This varies. Another problem with this antacid is the rebound hyperacidity. Note down. Rebound hyperacidity. Don't mix it up with the rebound hypertension. How this rebound hyperacidity is there, you should go through it. So these are various things you have to keep in mind while prescribing these. When to be given, when not to be given, when to be. You have to be conscious Disadvantage over here is about the sodium bicarbonate, rapid to act, duration is short, and rebound hyperacidity is a problem. You see over here, sodium is there, bicarbonate is there. They have their own merits and demerits. So one has to be very careful when not to give sodium. Note down. Absorbed systemically, metabolic alkalosis is posed. As carbonate is there, so belching, distension, flatulence may be there, perforation may be there. If there's some advanced case, perforation may be a problem. Sodium is to be avoided in hypertension and this congestive heart failure or renal insufficiency, sodium bicarbonate. Then about few lines about the calcium carbonate. Here you see the calcium is being given. If given in high doses, calcium will accumulate in body, given with milk. So one well-known side effect is the milk alkali syndrome. Just note down please. Milk alkali syndrome. That also happens with sodium bicarbonate. Milk alkali syndrome. Here we are giving calcium. Carbonate is also there. Something about calcium carbonate, it is the simple chalk used previously to write on blackboard. So calcium carbonate. Historically, this was the first antacid used. Onset is rapid, duration is relatively longer, but the disadvantage are because of the carbonate, belching is there. Calcium is there, hypercalcemia may occur in renal failure. Then hyperphosphatemia may be there, metabolic alkalosis may be there, milk alkali syndrome you have already been told. There is deposition of calcium in various parts of the body. Milk alkali, headache, dizziness, loss of hypercalcium, metabolic alkalosis, renal insufficiency that occurs in milk alkali syndrome. That of calcium deposits. If calcium deposits in all body parts have hypercalcinosis universalis, note down. Hypercalcinosis universalis. Then something about the aluminum salts, very commonly used aluminum hydroxide, aluminum oxide, like that. Here we are giving aluminum, and one has to be careful. And it's in the case of renal function, aluminum chloride. This aluminum chloride, so when it goes into gut, so it combines with phosphate. So the overall level of phosphate that may go down. Hypophosphatemia. Advantages of aluminum: duration is longer. So no carbon dioxide production, no disturbance of acid-base balance. Some of these salts, aluminum salts, they have got constipating effects. Magnesium salts, they have got constipation. Magnesium salts, they have got laxative effects. So the drugs which have got constipating effects, those are the laxatives, they are combined. Some of the drugs, some of the antacids, they have short-lived effect, while the others they have long. So they may be combined. About aluminum hydroxide, acid-base balance is not. Disadvantages. These are aluminum salts. They are slow to act. Constipation, you have already been told. Used with magnesium to counteract constipation. Magnesium salt, note down, they have got laxative effects. Magnesium oxide, magnesium hydroxide, like that. Magnesium trisilicate, very common example, trisilicate. That also binds drugs, decreasing their absorption. Aluminum salt, they have got adhesive property, and they may combine with certain other drugs and given side by side. So have a proper gap. Binds with phosphate in the intestine and prevent its absorption. So there may be hypophosphatemia. This hypophosphatemia may be of use in case of phosphatic kidney stones. On the other side, the disadvantage, there is phosphate deficiency given for a very long period, so maybe osteomalacia. Magnesium hydroxide. Not only magnesium hydroxide, you might have heard about the milk of magnesia, whitish liquid as they are given to children. Milk of magnesia. Magnesium salts, they are used at different, but like magnesium sulfate for conversions. So magnesium hydroxide over here. Advantages, there is no carbon dioxide production, no systemic alkalosis is there, and have longer duration of action. Magnesium salts. Disadvantages, they have got laxative effect. And be careful while given in case of renal failure. Magnesium absorbed, it has got depressant effect on the neurological in this at neuromuscular junction, and also they produce headache and suppression of the higher centers when absorbed. Drug interaction of these substances chelation, because the aluminum salts, magnesium, they chelate certain other chelation. Then chemical inactivation, they produce insoluble complexes. Then pH is increased absorption of. When the pH is increased, the basic substances, they are better absorbed, and there is problem. Then when the pH is increased, say with sodium bicarbonate, the acid drugs, they are more excreted, and basic, they are less. The enteric coated tablets cause premature dissolving of enteric coated tablets, and the pH disorder. Contraindications, you have already been told side by side contraindications. Sodium salts not given in case of hypertension, heart failure. Then calcium salt not to be given in case of hypercalcemia, or the calcium stones are already there, or maybe. Aluminum salts, they produce constipation. Magnesium salts, they may produce laxative, and in renal insufficiency avoided. When to be given antacid? Usually note down, antacid be given 1 hour after food, and then 3 hours afterward, and usually at bedtime. It's the general prescribing instruction. Then here it is written that they should not be combined antacids with tetracyclines. There are certain important drug groups with fluoroquinolones, itraconazole, and iron.